Earlier in this video, you can see this brother and sister playing on trampoline, but right before that, they took a little hard candy and ate it. And jumping around trampoline with a candy in your mouth is never a good thing. Very quickly, shortly after they eat the candy, the brother chokes on the candy because he's jumping and falling, and all of a sudden that hard candy goes straight in his throat and he starts coughing. What's amazing is that the sister knew exactly what to do. Without any hesitation, without panicking, she saved his life. She knew exactly what to do. Now, it's not often that people know what to do when someone's choking, especially kids. Very rarely a kid knows what to do. And did you know that more than 80% of the people that end up in the hospital because of fatal choking are actually children? Why? When children are eating, a lot of times they're jumping around, they're talking, they're laughing, they're playing, they have a much smaller throat. A lot of them actually eat in such a rush for no reason. In younger children, they're still learning how to chew and how to swallow. And some of them just don't even have that strong of a throat muscle. So when they're choking on something, when there's an abstraction, they cannot just throw it out. They cannot cough and clear that space. And all of that is exactly why you need to know what to do if you see someone choking, whether if it's adult, whether if it's a kid, whether if it's an infant. You need to know. In that video, the little girl performed an abdominal thrust. So how do you perform an abdominal thrust? You put your hands around their waist and you make a fist. You push that in and up. It's like a U-J motion. What that does is make the diaphragm like a natural air pump so that whatever is in here just get pushed up and out. If someone's pregnant or if it's an infant, you use the chest. So you push straight into the chest 5 times. If it's an infant, you're using 2 fingers right onto the chest. A lot of people are familiar with back blows. They just tap on the back, sometimes intentionally, sometimes they don't even know what they're doing. They've just seen it in a movie and they're just hitting it. What you need to know is that you're hitting as firm as you can. You're not going to be worried about, oh, what if he gets hurt? What if he gets bruises on their back? No, a proper way to do this is actually hurting them and getting some bruises on their back. If you're not doing this, you're probably just kind of like, you shouldn't be doing that. And most importantly, you're gonna encourage them to keep on coughing because coughing actually works better than everything that you're doing. If it's an infant, you can start coughing. Infants mimic what you do. So keep on time, keep coughing, and you can do the abdominal thrust, chest thrust, or the back blows. You do all of these 5, 5, 5, and you keep repeating them. If someone is choking on a wheelchair, make sure to lock the chairs on that wheelchair. Don't just start doing things with the wheelchair moving around. If you're alone and you're choking, you need to find a safe object to throw yourself onto it. You're going to perform that abdominal thrust with a safe object, whether if it's a part of a couch or a table. Make sure it's not sharp. Make sure you go somewhere that people can see you. If you're inside your house, walk out so that if something does happen, somebody can see you. Call 911 and put the phone there. We've talked about choking, abdominal thrust, back thrust, all of that. What happens if someone completely chokes? They're not coughing anymore, they're not making any noise anymore, and they're going into an unresponsive stage. Their eyes are closing. You're gonna need to go straight into the CPR stage. You're not gonna be sitting here worried about, oh my God, am I gonna continue doing abdominal thrust? No, you're gonna put them flat onto the ground on a hard surface and you're gonna start doing CPR, and that is 30 compressions and 2 rescue breaths. You're gonna ask your coworker, your friend, somebody to call 911 and get an AED. Be prepared, be ready for this. Getting yourself some training on CPR, getting yourself some first aid training is a very quick thing, but it can potentially save your life, one of the kids in your daycare's life, somebody's life. And you never know when it's going to happen. We all think it's not going to happen to me. We all think that, oh, it happened to the neighbor, it happened to the friend, it happened to whomever, but it can happen to you as well. And when you know what to do, just like that little girl, that's when you're going to be like, oh my God, I'm so happy that I went through that training. I know that that training is available in schools, but as adults, sometimes we just completely neglect it. Make sure you get your training done.